So we'll start. In case if there is any problem with the voice or the screen, give a message. I'll pause and see for any issues. The video is being recorded, so whenever you want to view it again for any revision, you can view it for another 30 days from now, or if you want to watch more than 30 days, you have to download the video. It will be a very lengthy video, so do not download all the videos, but if it is very important and you need to watch it again beyond 30 days, then you can download the video. Otherwise, it will be available in the group as well. So let's get started to this video. So for anatomy brush-ups, anatomy, though it looks very vast, I have just compiled all the important points alone like this. So when you are watching the video again for the second time, or if you are doing any revision, I want all of you to maintain a notebook like this and write down all the basic important points which you'll be revising before the exam also, because these are the must know points from the entire anatomy. From the entire anatomy, even if you haven't touched the book, you should have been studying at least these points. So I'll just brush up what all are there and what are very important from MCQ point of view. And any doubts from this video or anything which I have missed it out, I'll explain in the WhatsApp group. So this topic wise points which I have taken is from dental pulse. So dental pulse, we have many chapters like osteology, nerve supply, blood supply, like that. So from the osteology point of view, what all you should know. So osteology, the bregma and lambda. From MCQ point of view, they'll ask about what is bregma and what is lambda. So bregma is the joining point between the coronal suture and the sagittal suture, whereas lambda is the joining point between the sagittal suture and the lambdoid suture, that is near the occipital bone. Then pterion, asterion. So I have explained again and again in our previous webinar as well regarding pterion and asterion. So I'm not going in depth, but at least osteology I'll run through very quickly, because these are the things which we have studied again and again. Pterion, asterion, we have many flashcards related to it. So I'll post all the flashcards also, or you can see the notes PDF. The points related to pterion will be there. The 4 bones which comes under pterion is very, very important. Then foramen rotundum. Why foramen rotundum is? Foramen rotundum, the other name for it is magic foramen. Why it is called as magic foramen? Because the maxillary nerve passes through foramen rotundum. So when you take a cut section of the brain, in the cranial cavity on the inner portion, you will see the foramen. But the foramen rotundum does not exit in the base of the skull. That is, other foramens like foramen ovale, spinosum, if you flip the brain and see the base of the skull, you will see the foramen. But whereas foramen rotundum, if you flip it, you will not see near the base of the skull. That is why it is called as magic foramen, because the foramen vanishes when you see the base of the skull. The reason for it to vanish is foramen rotundum does not straight away pass through and through. Rather, it goes into a very complex course and it opens into the infratemporal, pterygopalatine fossa and infratemporal fossa, near that region where we are giving LA. When you go almost posterior most, when your needle touches, it goes into the pterygopalatine fossa. So that region, this foramen rotundum opens, and the structure passing through foramen rotundum is maxillary nerve. So this one is important from MCQ point of view. Then the next foramen which is important is foramen ovale and foramen spinosum. Very, very important and very, very confusing. Which part confuses between these two foramen is the meningeal artery. So meningeal artery, you have middle meningeal artery and accessory meningeal artery. So do not go deep into everything, but from MCQ what you should know is ovale, the mnemonic is male. M stands for mandibular nerve, A stands for accessory meningeal artery, L stands for lesser petrosal nerve, and E stands for emissary vein. Whereas for spinosum, the mnemonic is MMM. M stands for middle meningeal artery, another M stands for middle meningeal vein, another M stands for mandibular nerve. So here the main word is meningeal artery. So always whenever an MCQ is being asked regarding middle meningeal artery, immediately our hand or our mind thinks of ovale. Because of the mnemonic male, you get confused. M stands for middle meningeal artery. No, in the ovale male, everybody remembers the mnemonic, but they forget M stands for what. So M stands for mandibular nerve. It does not stand for middle meningeal artery. So always remember, for ovale, it is accessory meningeal artery, and for spinosum, it is middle meningeal artery. So never ever get confused between these two foramen. So this is very important from MCQ point of view. Then another one is the structures passing through superior orbital fissure. So for the nerves and all, there is a mnemonic, live frankly to see absolutely no insult. Go through the mnemonic, it is there in the pulse book, or even if you Google mnemonic for structures passing through superior orbital fissure, you will get some mnemonic. Why it is important is there are many different nerves which passes through superior orbital fissure. That is quite important. So these are the things which you should mainly know about osteology, because there are many foramens, many structures, many things related to osteology, but at least these important things you should know. Then the next one, foramens that pass through greater wing of sphenoid. So greater wing of sphenoid bone, you have body of the sphenoid, greater wing and then lesser wing. So under the greater wing of the sphenoid, what are the foramens that passes through? So we have foramen rotundum, foramen ovale, foramen spinosum, and then emissary sphenoidal foramen. The other name for it is foramen vesalius, and the mnemonic for that is rose. So foramens passing through greater wing of sphenoid, the mnemonic is rose. Then we have one more thing, foramen transfusorium. The reason foramen transfusorium, why it is important is you have vertebral, cervical vertebra, thoracic vertebra, like that. So how cervical vertebra is very distinct from other type like the thoracic vertebra is the presence of foramen transfusorium. So foramen transfusorium is exclusively present in all the cervical vertebra, and the structures passing through foramen transfusorium is vertebral artery, vertebral vein, and then inferior cervical ganglion, the branch of inferior cervical ganglion. Then some important points. So the first bone to ossify in our entire body is clavicle. Then in the face, the first bone to ossify is mandible. In the entire body, mandible is the second bone. In the face, mandible is the first bone. A deep cervical fascia, if you are interested, you can read about it. Otherwise, you can completely skip this topic. Then the next one, salivary and thyroid gland. So salivary and thyroid gland, this mnemonic 3977 COPS. So what is this 3977 COPS is? What particular ganglion is related to what nerve? So the mnemonic for it is 3977. So before knowing the 3977 number, you should be very, very thorough with the cranial nerve numbers. So we have 12 cranial nerves starting from olfactory, then we have optic, then oculomotor, trochlear, trigeminal, abducent, facial nerve, vestibulocochlear nerve, glossopharyngeal nerve, vagus nerve, then we have accessory nerve, then hypoglossal nerve. The mnemonic for that is, one of our trained teacher asked for very good vada and Horlicks. So I'll type in the mnemonic in the group. You can read again. This is very, very important, because only when you know the cranial nerve numbers properly, all these mnemonics are very, very easy to remember. So cranial nerve 3977. You write 3977 on one side and COPS on the other side. 3 stands for oculomotor nerve. C stands for ciliary ganglion. So ciliary ganglion, the nerve related to ciliary ganglion is oculomotor nerve. Then you have 9. 9 stands for glossopharyngeal nerve. O stands for aortic ganglion. So the nerve responsible for aortic ganglion is the 9th cranial nerve. Then we have PS. P stands for pterygopalatine ganglion and S stands for submandibular ganglion. Both of them are related to the 7th cranial nerve, which is facial nerve. So this is very important, because the parotid gland, the secretomotor fibers, that is the related to any glandular secretions, you will have all these ganglions, be it lacrimal gland, be it salivary gland, any secretion, that is what is called as secretomotor fibers. So these secretomotor fibers supply For the parotid gland, it is from aortic ganglion. For the submandibular and sublingual gland, it is submandibular ganglion. For the lacrimal gland, we have ciliary ganglion. And for other gag reflexes and other such things, we have the pterygopalatine ganglion. Pterygopalatine ganglion, apart from that, it has other functions as well. But just remember that particular gang and the nerve responsible for the particular ganglion. Then you have two words called inferior salivatory nucleus and superior salivatory nucleus. So you don't need to understand the concept behind it, but from MCQ, what you need to know is you have to use some tricks to remember this. Okay. So the salivatory nucleus is responsible for the secretomotor fibers for the particular salivary glands. So we have three major salivary glands: parotid gland, then we have submandibular and sublingual. So parotid gland is located superiorly, that is above the submandibular gland, whereas submandibular gland and sublingual gland, they are located inferiorly, below. So above is parotid, below is submandibular and sublingual. Now this inferior and superior, just flip it or match them diagonally opposite. So when you have parotid on the superior side, the salivatory nucleus responsible for that is inferior, whereas you have submandibular and sublingual below, the salivatory nucleus responsible for that is superior. No need to understand the concept, but just remember them, because in case of MCQ, they ask what salivatory nucleus is responsible for what particular gland or what particular ganglion. First, you should be very clear with what ganglion is for what gland. So parotid gland, aortic ganglion, the nerve is 9th cranial nerve. Then you have submandibular and sublingual gland. The ganglion is submandibular ganglion and the nerve is facial nerve. So this, if you are very clear, the inferior and superior salivatory nucleus, matching them is very easy. Superiorly, the parotid gland is present. So the nucleus responsible is inferior nucleus. Inferiorly, the submandibular gland is present. So the nucleus responsible is superior salivatory nucleus. We are done with this. Then we'll go on to the other things related to salivary and thyroid glands. So we have one structure called as mylohyoid muscle. So there are two MCQs related to mylohyoid muscle. They'll ask is the position of sublingual gland. So remember, sublingual gland is a superficial gland, and the position of sublingual gland is just below the mucosa and above the mylohyoid. So they can ask a question in either way. How is the sublingual gland situated? So how it is below the mucosa and above the mylohyoid. Or another way how they'll ask is the location of the sublingual gland is superior to mylohyoid, inferior to mylohyoid. So below, above, it is easy to orient. Suddenly when they ask like superior to, inferior to, don't get confused. Be it submandibular gland or sublingual gland, everything is above the mylohyoid muscle. Okay. So the sublingual gland, 100% of the sublingual gland is present above the mylohyoid, which means they are present superior to the mylohyoid muscle. So when it comes to the submandibular gland, you have a larger superficial part and a smaller deep part. So the name itself says superficial deep. So the superficial part is present above the mylohyoid. The deep part is present below the mylohyoid. So which means mylohyoid muscle is the one which divides the submandibular gland into two parts. So clear with it? They'll ask two MCQs related to mylohyoid. One is with sublingual gland, one is with submandibular gland. If it is sublingual, no doubt at all, it is completely present above the mylohyoid, below the mucosa. Submandibular, the superficial part is above the mylohyoid, the deep part is below the mylohyoid muscle. Then the structures within the parotid gland. So the structures within parotid gland, there will be a lot of confusions related to it. They'll ask questions with auriculotemporal nerve, all those things. Just remember one thing very clearly. If it is within the parotid gland, only facial nerve is the nerve which is present within the parotid gland. How you can remember this is, whenever you are giving LA, when you are giving the inferior alveolar nerve block, when you are going deep, sometimes suddenly patient will have nerve palsy, facial nerve palsy. So how it will present facial nerve palsy? The patient will have changes with the facial musculature on one particular side wherever you are injecting. Why the patient is having sudden facial nerve palsy is because you would have injected the local anesthetic material into the parotid gland accidentally. So into the parotid gland, suddenly you are injecting some LA and immediately there is reaction to the facial musculature. So which means the only nerve structure which is present within the structure of parotid gland is facial nerve. In case if the question is structures around the parotid gland, then you have obviously facial nerve is there. Apart from that, there is one more nerve called auriculotemporal nerve, which is associated with the lateral surface of the parotid gland. So always read the question carefully. If they ask nerve related to the parotid gland, if it is within the structure, it is only the facial nerve and the 5 branches of them which is inside the parotid. If they ask on the lateral surface, apart from facial nerve, the one more nerve which is associated with the parotid gland is auriculotemporal nerve, which is a branch of mandibular nerve. And mandibular nerve, in turn, it is a branch of trigeminal nerve. So a quick brush up, trigeminal nerve is a 5th cranial nerve. So trigeminal nerve, we have maxillary nerve, mandibular nerve, and then we have ophthalmic nerve. So this mandibular nerve, you have anterior division from the main trunk, you have anterior division, then you have nerve to medial pterygoid, then you have the posterior division, under posterior division we have auriculotemporal nerve. So again, coming back to the structures in parotid gland, the only question related to parotid gland what they'll ask is, if it is within parotid gland, only facial nerve. Outside the parotid gland, apart from facial nerve, you have auriculotemporal nerve associated with it. Then you have another structure called subclavian artery. So this subclavian artery, superior thyroid artery, inferior thyroid artery, during the last minute, if you are trying to read, it will be very, very confusing. So completely you can skip it. One point which you should know is superior thyroid artery is a branch of external carotid artery, whereas inferior thyroid artery, it is not a branch of external carotid artery. Only so much if you read, it is more than enough. External carotid artery, again we have 8 branches. The mnemonic for that is Sister Lucy's powdered face often attracts medical student. So we have 8 branches of it. The first anterior branch is a superior thyroid artery. So superior thyroid artery, it mainly supplies the upper part of the thyroid cartilage, whereas the inferior thyroid artery, majority of the thyroid is supplied by the inferior thyroid artery, and apart from that, the trachea is supplied by inferior thyroid artery, parathyroid glands are supplied by inferior thyroid artery, thymus, larynx, pharynx, they all are supplied by inferior thyroid artery. So this, so much if you read, it is enough. Then the structures derived from pharyngeal pouch. It is very, very important. Under that, there are 2 MCQs from the structures derived from pharyngeal pouch. One is structure derived from the 5th pharyngeal pouch. The other name for it is ultimobranchial body. The structures derived from that is the parafollicular cells of the thyroid gland, are also called as C cells. Then the second question from pharyngeal pouch which they will ask is inferior parathyroid and superior parathyroid. Again, like how we remembered the inferior salivatory nucleus and superior salivatory nucleus, like that only you have to remember. Superior means on the top, inferior is below. So now write the number 3 and 4. 3 is in the top, 4 is below. Then diagonally opposite, flip them and match. So third, it is inferior parathyroid, because see, inferior parathyroid means it will be present below. Superior parathyroid means it will be present above. But matching wise, the third pharyngeal pouch, the structure derived from is inferior parathyroid. From the 4th pouch, it is superior parathyroid. Never ever get confused between these two, because this is one more MCQ point which they'll ask. Immediately 4th pharyngeal pouch, when they ask, our mind will think of inferior parathyroid. No. From the 3rd, it is inferior. From the 4th, it is superior parathyroid. Then the next one is thyroid veins. Thyroid veins, the superior and middle thyroid veins, they drain into internal jugular vein, whereas the inferior thyroid vein, they drain into left brachiocephalic vein. It is very least important, so I'm just reading them. If you want to remember, you can remember, but it is not a very important point. Then common carotid artery, yeah, that one is important. because you have two common carotid artery. Right one, it is a branch of brachiocephalic artery, whereas left one, it is directly from the arch of aorta. Then submandibular gland relation, you don't need to know all the surfaces, but the medial surface is very, very important. The three muscles which are related medially to the submandibular gland, the three muscles are mylohyoid, hyoglossus and styloglossus. These are the three muscles which are related to the medial surface of the submandibular gland. Then the nerve supply. So coming to the nerve supply, we have two or three things which states all muscles are supplied by so and so nerve except this. So under that, I'll be reading everything. First one is soft palate. So soft palate, the motor supply, all the muscles are supplied by pharyngeal plexus through cranial part of accessory nerve except the tensor veli palatini, which is supplied by mandibular nerve. So now I'll just give a small explanation related to this pharyngeal plexus. So now the 11th cranial nerve is called as accessory nerve. This accessory nerve is a very interesting nerve because accessory nerve has two roots. One root is called as cranial root, the other root is called as spinal root. So spinal root, from the cervical vertebra, there are many spinal branches which joins, and the spinal root enters the brain through foramen magnum. So the spinal root of accessory nerve enters the brain through foramen magnum. Then we have another cranial root. So this cranial root and the spinal root joins to form a nerve called as accessory nerve. Again, this accessory nerve exits a cranial cavity via foramen, jugular foramen jugulaire. So after the exiting through foramen jugulaire, the cranial part goes and supplies some other organ, some other places, whereas this spinal accessory nerve, some branch of it will join the pharyngeal plexus. So pharyngeal plexus, don't get confused. How the pharyngeal plexus is formed is some of the nerves from the vagus nerve, which is the 10th cranial nerve, gets joined along with this spinal part of the accessory nerve to form the pharyngeal plex. So now, getting back to the nerve supply. All the muscles of the soft palate are supplied by pharyngeal plexus through the cranial part of accessory nerve, which means pharyngeal plexus is actually a vagus nerve, but the nerve is derived from vagus nerve plus the accessory nerve. So don't get confused. Why I'm explaining this again and again is, whenever there is an MCQ, there is one possibility of MCQ which is very easy. They'll ask option tensor veli palate will be there. So all muscles are supplied by so and so nerve except. So immediately you can find out the odd one out. The odd one is tensor veli palatini, because tensor veli palatini is supplied by mandibular nerve. Now, the most confusing and toughest part is the tensor veli palate is not at all involved. The involvement is all the other muscles of the soft palate with, they'll give option vagus nerve. So we would have already remembered by accessory nerve. Accessory nerve is a 11th cranial nerve. 11th cranial nerve will not be there in the option itself. So now how you will select? You have to select the vagus nerve. The reason for that is pharyngeal plexus is a combination of vagus nerve plus accessory nerve. Though accessory nerve supplies, accessory nerve is strengthened by the pharyngeal plexus, which is supplied by vagus nerve. So if accessory nerve option is there, you have to go for the accessory nerve. In case if it is not there, then you have to choose a vagus nerve. Usually they'll just mention pharyngeal plexus. In case if the question is going to be very tough, instead of the word pharyngeal plexus, they'll give either 11th cranial nerve or 10th cranial nerve. If both are there, go for the 11th cranial nerve. But in case if the 11th cranial nerve is not there, then you have to select the 10th cranial nerve. Okay. Now, apart from the motor nerve, the other supply we'll see. The sensory supply. So, sensory supply, middle and posterior lesser palatine nerve is there. Then glossopharyngeal nerve. Glossopharyngeal nerve is a 9th cranial nerve. Maxillary nerve is a branch of trigeminal nerve, which is the 5th cranial nerve. Then we have the special sensory, which is the taste sensation, gustatory. So, little bit of soft palate has some gustatory sensation as well, and that is supplied by lesser palatine nerves, which is a branch of maxillary nerve. The next one related to larynx. So larynx it is not very important, but at least this all muscles are supplied by that you should know. So we have 9 muscles of larynx. All the muscles are supplied by recurrent laryngeal nerve except cricothyroid, which is supplied by external laryngeal nerve. The mnemonic for that is ACER, and how I have put a box CE. C stands for cricothyroid supplied by external laryngeal nerve. A stands for all. R stands for recurrent laryngeal nerve. So all the muscles of larynx are supplied by recurrent laryngeal nerve except cricothyroid, which is supplied by external laryngeal nerve. So that is one MCQ point. Another MCQ point is you have two recesses in the larynx pharynx region. One recess is called as pyriform recess. So pyriform recess is present in laryngopharynx. Then you have one more recess called as pharyngeal recess. Pharyngeal recess, the other name is fossa of Rosenmuller. So pharyngeal recess is present in nasopharynx. Not very important, but just a point to note down. Then you have one more thing called adductor and abductor. So first you should know what is an adductor and what is an abductor. So adductor is when something is away from the midline, then it is called as adductor. When it is close to the midline, it is called as an abductor. Now, no need to learn all the muscles which are responsible for various functions of the larynx, because there are 4 or 5 muscles in each. So, these two are the important ones of all, because these two, they are the muscles responsible for that particular action, and they are the single muscle. So, it is very important. So, the crico Am I audible now? The screen is visible. Okay. Screen is visible now. Okay. So now let's get back. After the Waldeyer's ring, this is one more important point. All the constrictors of pharynx, they are from the fourth arch derivative. So from the embryology point of view, all the constrictors of pharynx, they are derived from the fourth pharyngeal arch. Then moving on to the next topic, tongue. So tongue, we have the very important point from tongue is the nerve supply, the motor and the sensory nerve supply. So motor supply, like how I mentioned for the palate, like that for tongue we have all the muscles of tongue, be it intrinsic or extrinsic muscle, all the muscles of tongue, they are supplied by hypoglossal nerve, which is the 12th cranial nerve, except palatoglossus. Palatoglossus is supplied by the accessory nerve through pharyngeal plexus. Then the sensory supply. So sensory supply, the anterior 2/3 of the tongue is supplied by lingual nerve. The posterior 1/3 of the tongue is supplied by glossopharyngeal nerve. The taste sensation, anterior 2/3 is supplied by chorda tympani nerve, which is a branch of facial nerve. Then we have posterior 1/3 is supplied by glossopharyngeal nerve. Posterior most part is supplied by vagus nerve, which is a 10th cranial nerve. Then the taste sensation. So taste sensation, we have 4 papillas, foliate papilla, filiform papilla, fungiform, and then circumvallate. Maximum number of taste buds are present in circumvallate papilla and no taste buds in filiform papilla. So these are the 2 things which you should know from papilla. Then the arterial supply of tongue. The major arterial supply is lingual artery. It is very easy. If the MCQ's option is there, lingual artery is there. But the question is going to be tough. Lingual artery will not be there in the option, but they'll ask tonsillar and ascending pharyngeal artery. So tonsillar artery is a branch of facial artery and ascending pharyngeal artery is a direct branch of external carotid artery. Facial artery in turn again is a branch of external carotid artery. So these are the other branches which also supply the tongue. So majorly it is lingual artery. Apart from that, we have tonsillar artery and ascending pharyngeal artery. The venous drainage is from deep lingual vein. Then you have one important word called palatoglossal arch and palatopharyngeal arch. So we have something called as fascial pillar. So you have tonsil, anteriorly you have one wall, posteriorly you have one wall. So this fascial pillar, anteriorly it is formed by the palatoglossus muscle. So the arch is called as palatoglossal arch, whereas posteriorly it is formed by palatopharyngeus muscle. So it is called as palatopharyngeal arch. The reason for that is when you move the tongue, which arch is being affected because of the movement of the tongue? It is palatoglossal arch, because palatoglossal muscle, whenever you move some tongue, there is always some changes in the anterior fascial pillar alone. Posterior fascial pillar, nothing is related to movement of the tongue. So always remember the palatoglossal arch, when there is some tongue movement, there is some changes or some movement being noticed in the palatoglossal arch as well. So this is one important point. Then coming to the nerve supply of pharynx. So we have so far seen the nerve supply of soft palate, nerve supply of muscles of larynx. Then we saw nerve supply of tongue. Then we are moving to nerve supply of pharynx. So nerve supply, all muscles of pharynx are supplied by vagus nerve, which is the 10th cranial nerve, except stylopharyngeus muscle, which is supplied by glossopharyngeal nerve. The mnemonic to remember that is styloglosso. So stylopharyngeus muscle is very stylish, so it always applies gloss. So stylopharyngeus is supplied by glossopharyngeal nerve. So so far we saw 4 things, all supplied by so and so, except they include, first one we saw soft palate, all the muscles of soft palate. Then like that we saw muscles of intrinsic muscles of larynx we saw, then we saw muscles of tongue, then we saw muscles of pharynx. These are the 4 things where you will see all are supplied by some particular nerve, and except this particular muscle which is supplied by so and so nerve. So you have to write down all these things in a notebook like this, so that last minute you can revise it once again. So then moving on to the next one, vascular supply of head and neck. So from vascular supply of head and neck, the important one is internal carotid artery. So internal carotid artery, we have cervical part, petrous part, cavernous part, and the branches, cervical there are no branches, but petrous part, cavernous part, the branches in it, they are not very important. The cerebral part, the branches in it is important, of which the ophthalmic artery is very, very important, because we always get confused. The facial structures, almost all the arterial supply is mainly by facial artery. Facial artery is a branch of external carotid artery. So immediately when we see eyeball, forget the muscles. The eyeball, it is supplied by ophthalmic artery. So the moment it is related to eye, we get confused. We go and select the option facial artery, or we go and select the option external carotid artery. It is wrong. Eyeball, it is supplied by ophthalmic artery, which is a branch of internal carotid artery. So this is a very important MCQ point. And apart from that ophthalmic artery, you should know 2 branches of ophthalmic artery. The reason for that is, these artery names, they almost sound like they are branches of, some branches of external carotid artery, because it is very difficult for us to remember the branches of external carotid artery itself is very difficult. The branches of them, remembering them is very, very difficult, because for maxillary artery, we have a mnemonic like Damai, Picpas, like that. There are some 16 branches of maxillary artery. So remembering all the names are very difficult. So the anterior and posterior ethmoidal artery is very important. Why? Because anterior and posterior ethmoidal artery is a branch of ophthalmic artery, which is internal branch of internal carotid artery. So odd one out, if you are able to remember, you can easily eliminate. The trick for solving anatomy MCQ is, if you are very sure about your answer, go for the right answer. But even if you have 1%, 2% confusion, do not select the right answer. Rather, you cancel out all the wrong answer, and finally what you are getting, the solution, that will be your right answer. Now coming back to our topic. This is the one ophthalmic artery alone. If you remember, it is enough. Then after that, external carotid artery, as I have mentioned the mnemonic earlier, Sister Lucy's powdered face often attracts medical student. You have superior thyroid, lingual artery, pharyngeal artery, then facial, occipital artery, ascending pharyngeal, maxillary artery, and superior thyroid artery. Just remember the mnemonic, the Sister Lucy's powdered face often attracts medical student, and then you can remember the artery name. Then coming to cavernous sinus. So cavernous sinus, you don't need to learn everything about cavernous sinus. These 4 points, and then what is cavernous sinus thrombosis, and what leads to cavernous sinus thrombosis. So basically, cavernous sinus, it drains into so many 4 sinuses. They include the transverse sinus, then internal jugular vein, pterygoid plexus of vein, facial vein. How it drains into transverse sinus? So it is cavernous sinus through superior petrosal sinus, it reaches transverse. From cavernous sinus through inferior petrosal sinus, it reaches IJV. From cavernous sinus through emissary vein, it reaches pterygoid plexus of vein. And again from cavernous sinus through superior ophthalmic vein, it reaches facial vein. So now you know the route. So you can write cavernous sinus on top, and from there 4 arrows. Those 4 arrows leading to superior petrosal, inferior petrosal, emissary, and superior ophthalmic. And from them they lead to The next one is transverse IJV, pterygoid plexus of vein and facial vein. So these 4 points, if you remember, of which the last two, pterygoid plexus of vein and facial vein. These are the two veins which easily get involved in infection leading to cavernous sinus thrombosis. So pterygoid plexus of vein, how it easily gets involved is whenever you have some infection, say in the loose areolar tissue in the scalp, there are many emissary veins which runs, and so when any infection happens in the scalp, easily that infection reaches the emissary vein, and from there it reaches pterygoid plexus of vein, and from there it goes to cavernous sinus. So it is a retrograde pathway. So it can easily reach the cavernous sinus. Same way, whenever there is some infection, say in the canine tooth, upper lateral incisor, or any infection near the nose region, the dangerous area of face it is called as. So from there that infection easily reaches a facial vein, and from there some superior ophthalmic vein into cavernous sinus. Or any infection near the pterygoid plexus, say in the posteriormost region, near the pharynx, any pharyngeal infection when you have, it reaches pterygoid plexus of vein to the emissary vein to the cavernous sinus. So these are the three structures: the facial vein, emissary vein and pterygoid plexus of vein. These things, any structures adjacent to it, if they get infected, from there it can easily reach the cavernous sinus, leading to cavernous sinus thrombosis. So now how they will ask MCQ is, dangerous area of face leads to cavernous sinus thrombosis through. Obviously, facial vein is the answer, but in the option they will not mention facial vein. They will mention the option as superior ophthalmic vein. Facial vein, it is easy to identify, but from facial vein it goes to the superior ophthalmic vein. So you should remember the word superior ophthalmic vein. So cavernous sinus thrombosis usually gets involved because of superior ophthalmic vein through the facial vein. So remember these words. Even if you don't understand the concept and the pathway, cavernous sinus thrombosis, the words related to cavernous sinus thrombosis, in the option, what you should search for is superior ophthalmic vein, facial vein, pterygoid plexus of vein and emissary vein. These are the 4 words which you have to search related to cavernous sinus thrombosis. If it is very specific, say dangerous area of face, you have to search only for 2 words, facial vein and superior ophthalmic vein. If it is dangerous area of scalp, you should search for only 2 words, pterygoid plexus of vein or emissary vein. Pterygoid plexus also you cannot search, but emissary vein will obviously be there for if it is dangerous area of scalp. So this is the only point which you should read about cavernous sinus. Apart from that, you can skip everything related to cavernous sinus. Next one, the branches of vein. I have just mentioned the flow chart, how the facial vein is being formed. If you can understand the flow chart, it is fine, but otherwise you can skip this topic. No MCQ, no important MCQ has come from this facial vein branches. Next one, which is very, very important, is carotid sinus and carotid body. So carotid sinus is a baroreceptor. Baroreceptor means it is a pressure receptor. So any change in the pressure of the carotid region, carotid sinus gets activated. And carotid sinus, where is it present? It is present in the termination of the common carotid artery or at the beginning of internal carotid artery. Then the next point is carotid body. Carotid body is a chemoreceptor which is responsible for any chemical alteration in the content of the blood. That is, any alteration in the oxygen carbon dioxide content of the blood, any change or alteration in them will activate the chemoreceptor, which is carotid body gets activated, and carotid body is present at the bifurcation of common carotid artery. This is a very, 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 very important MCQ. Carotid sinus is a baroreceptor, carotid body is a chemoreceptor. Very, very important. And a simple trick to remember is carotid body, B is already present, so it is not baroreceptor. Whereas carotid sinus, S, so B is not there, so it is a baroreceptor. It's a small simple trick to remember during the last minute, but if you have already studied and understood the concept, it is fine. But if you want to remember during the last minute, remember carotid body, B is already present, so there is no one more B. So it is not baroreceptor, it is a chemoreceptor. The other one is sinus baroreceptor. That's all. Then upper lip, we have mentioned upper lip usually reaches the facial vein. The supply and all through facial vein, upper lip drainage is there. That is why we studied about dangerous area of face. So lower lip is gets drained into brachiocephalic vein. There is no MCQ related to it, but at least you should know the drainage of it. Upper lip, it gets drained into facial vein. Lower lip is brachiocephalic vein. So some of the important topics I have covered up so far. Then the nerve supply of head and neck. Already I have mentioned so many things related to nerve supply, like the muscles of soft palate, muscles of tongue, pharynx, everything. Apart from that, the muscles of mastication you should know. The nerve supply of muscles of mastication, all the 4 muscles of mastication, they are supplied by mandibular nerve. Then the nerve supply of head and neck, you should remember the mnemonic LR6SO4 remaining 3. This is for the muscles of the eye, ocular muscle. So LR6SO4 remaining 3 means LR stands for lateral rectus. Lateral rectus is supplied by abductor nerve, which is the 6th cranial nerve. Then SO4, SO stands for superior oblique, which is supplied by the trochlear nerve. Remaining all the other ocular muscles, they are supplied by nerve number 3, which is the oculomotor nerve. The importance for that is whenever a lateral rectus gets paralyzed, the patient will have medial squint. When a medial rectus is paralyzed, patient will have lateral squint. The reason why I am explaining is when there is only a lesion of only the 6th cranial nerve, that is when there is lesion of abductor nerve alone, the patient will have a medial squint. Squint means the eyeball moves toward one particular side. So when lateral rectus is paralyzed, eyeball will move towards the medial side, opposite side. So when there is lesion of the 6th cranial nerve, patient will have medial squint. When there is lesion of the 3rd cranial nerve, which is the oculomotor nerve, which is very, very common. 3rd cranial nerve paralysis is more common than the 6th cranial nerve. So 3rd cranial nerve, when there is paralysis, we saw the mnemonic LR6SO4. So lateral rectus is 6th, superior oblique is 4th. Remaining means medial rectus is present in the remaining muscles. So medial rectus is supplied by 3rd cranial nerve. When there is medial rectus paralysis, patient will have lateral squint. So abductor nerve paralysis, patient will have a medial squint. Oculomotor nerve paralysis, patient will have a lateral squint. This is an MCQ point. Then a little bit least important one is Horner syndrome. So Horner syndrome, when there is any injury to cervical sympathetic trunk, the patient will have Horner syndrome. It will affect the ciliary ganglion and the patient will have the following features. The patient will have ptosis, meiosis, anhidrosis, anophthalmosis. Ptosis is also present in the 3rd nerve palsy. So 3rd nerve palsy, patient will have lateral squint and ptosis. Apart from the 3rd nerve palsy, one more condition where the ptosis occurs is Horner syndrome. Then after that, other nerve supply, the important one is digastric muscle. So digastric muscle, you have anterior belly and posterior belly. Anterior belly is supplied by mylohyoid muscle. Posterior belly is supplied by anterior belly is supplied by nerve to mylohyoid, which is a branch of mandibular nerve, which is a branch of trigeminal nerve, that is 5th cranial nerve. The posterior belly of digastric is supplied by facial nerve. And muscles of mastication, as I have already mentioned, it is supplied by mandibular nerve, which is a branch of trigeminal nerve, that is 5th cranial nerve. So these are the must know points from anatomy. To sum up, I'll just brush up what all I have read so far. Osteology, bregma, lambda, pterion, asterion, foramen rotundum, which is a magic foramen, foramen ovale and spinosum. Ovale is accessory meningeal artery and spinosum is middle meningeal artery. Then foramen magnum and foramen jugular foramen, I mentioned foramen magnum, it is spinal root of accessory nerve, and foramen jugular foramen, it is an accessory nerve which passes through. So whenever there is an MCQ, if it is an easy MCQ, foramen magnum, it is spinal root. Foramen jugular, it is an accessory nerve. In case if the MCQ is going to be tough, if the jugular foramen option is not there, then you go for the foramen magnum for spinal accessory nerve. Then the foramen transfusorium, which is so typical for the cervical vertebra, it is not present in other vertebra like thoracic, lumbar, sacral and all. Then the first bone to ossify in the entire body, it is clavicle. In the head and neck region, it is mandible. Then salivary gland, I mentioned about 3977 corps. C for ciliary ganglion, O for aortic ganglion, P for pterygopalatine ganglion, and S for submandibular ganglion, and the nerves associated with the particular ganglions. Then inferior salivatory nucleus and superior salivatory nucleus. Inferior salivatory nucleus is responsible for aortic ganglion, that is parotid gland. Superior salivatory nucleus is responsible for submandibular ganglion, which is submandibular and sublingual gland. Then mylohyoid muscle, it divides the submandibular gland into superior, superficial and deep parts. And sublingual gland, it is always present superficial to mylohyoid muscle. Structures within the parotid gland, inside the parotid gland, only facial nerve is there. If it is outside the parotid gland, apart from facial nerve, auriculotemporal nerve is also involved in parotid gland. Then pharyngeal pouch, fifth pharyngeal pouch, ultimobranchial body. It is also called as ultimobranchial body. The C cells or parafollicular cells of thyroid gland is derived from that. Third pharyngeal pouch, inferior parathyroid. Fourth pharyngeal pouch, superior parathyroid. Then we read about thyroid veins. Then common carotid artery, they are least important. Submandibular gland relation. The medial surface of the submandibular gland, there are three muscles involved. It includes mylohyoid, hyoglossus and styloglossus. And then nerve supply of soft palate. All the muscles of the soft palate are supplied by pharyngeal plexus except tensor veli palatini, which is supplied by mandibular nerve. Apart from tensor veli palatini, one more muscle which is supplied by mandibular nerve is tensor tympani. Tensor tympani is in the auricular muscle in the ear ossicle. So we have tensor veli palatini and tensor tympani, both of them supplied by mandibular nerve. Then the sensory supply, middle and the posterior lesser palatine nerve. Then glossopharyngeal nerve. The special sensory supply for soft palate is by lesser palatine nerve, which is a branch of maxillary nerve. Then in the mouth and pharynx, we have mnemonic acer. All the muscles of the larynx are supplied by recurrent laryngeal nerve except cricothyroid, which is supplied by external laryngeal nerve. Pyriform recess is present in laryngopharynx. Pharyngeal recess is present in nasopharynx. The other name for it is fossa of Rosenmuller. Then muscles of larynx, the only muscle which causes tensing the vocal cord is cricothyroid. The only muscle which is responsible for abduction of vocal cord is posterior cricoarytenoid. Then we have Little's area or Kesselbach's plexus, which is an anastomosis between sphenopalatine artery, which is a branch of maxillary artery, plus superficial labial artery, which is a branch of facial artery. Then we have Waldeyer's lymphatic ring, comprises of 4 groups of tonsil, which includes the right and left palatine tonsil, pharyngeal tonsil, tubal tonsil and lingual tonsil. All the constrictors of pharynx, they are a 4th arch derivative. All the other arch derivative, it is understood. If it is not, just go through the tabular column for the pharyngeal arches derivative. Like how I have mentioned pharyngeal pouch derivative, pharyngeal arch derivative from the first arch, what are the structures, second arch, all those things, read the tabular column related to it. Then the tongue, all the intrinsic and extrinsic muscles of tongue, they are supplied by hypoglossal nerve, which is a 12th cranial nerve, except palatoglossus, which is supplied by the pharyngeal plexus. Sensory supply, anterior 2/3 is lingual nerve, posterior 1/3 is glossopharyngeal nerve. Taste sensation, anterior 2/3 is chorda tympani, which is a branch of facial nerve. Posterior 1/3 is glossopharyngeal nerve, which is a branch of 9th cranial nerve. Posterior most part is supplied by vagus nerve, which is a 10th cranial nerve. The taste buds, most number of taste buds are present in circumvallate papilla. No taste buds are present, no taste buds in filiform papilla. Then we have arterial supply. Majorly it is lingual artery. Apart from that, we have other arteries, namely tonsillar artery and ascending pharyngeal artery. Anterior fascial pillar formed by palatoglossal arch, formed by the palatoglossus muscle. Posterior fascial pillar is known as palatopharyngeal arch, formed by palatopharyngeus muscle. Then we have muscles of pharynx. All the muscles of pharynx are supplied by vagus nerve except stylopharyngeus, which is supplied by glossopharyngeal nerve. Then the vascular supply of head and neck, internal carotid artery. The important branch from the internal carotid artery is ophthalmic artery. The branches of ophthalmic artery, there are many branches, but the important ones which we often forget is anterior and posterior ethmoidal artery. Then we have cavernous sinus. The important point from cavernous sinus is Dangerous area of face, two veins are involved, facial vein through superior ophthalmic vein. Dangerous area of scalp, emissary vein and pterygoid plexus of vein. Then we have Carotid sinus, which is a baroreceptor, which means it is responsible for pressure alteration. Sinus is present at the termination of common carotid artery or at the beginning of internal carotid artery. Carotid body, it is a chemoreceptor which is responsible for the chemical content alteration in the blood, the oxygen carbon dioxide alteration. It is present at the bifurcation of common carotid artery. Then nerve supply of head and neck for the ocular muscle, the mnemonic is LR6, SO4, the remaining 3. If there is any lesion in the 6th cranial nerve, there is lateral rectus paralysis, which means patient will present with the medial squint. When there is 3rd nerve palsy, the patient will have medial rectus paralysis leading to presentation as lateral squint. Ptosis is also present in 3rd nerve palsy. Apart from that, one more condition where ptosis is present, ptosis is drooping of upper eyelid, it is present in Horner syndrome. Horner syndrome is due to injury of cervical sympathetic tongue. Then muscles of head and neck, all the muscles of mastication, they are supplied by myelobulbar nerve. Then digastric muscle, anterior belly is supplied by mylohyoid nerve, posterior belly is supplied by facial nerve. So I hope this brush up was useful. Some points here and there I would have missed out, but these are the very must know important point from anatomy. Whatever points, very important ones, in case if I have missed it out, I'll post this handwritten notes after completing them. And anything, any doubts from the MCQ, if you guys have, post it in the group. We'll have it as a discussion in between when we have any rapid fire round. We are done with today's session.